Hello, everybody. Thank you very much for attending this session, which is entitled Using Innovative Technology to Build Surgical Capacity Globally. On behalf of myself and the co-chair of this session with me, Dr. Linda Zhang. It's my pleasure to introduce you all to this session, which I believe is one of the most important sessions at the meeting this year. I think we're going to touch on a lot of really important and interesting and challenging topics. And I think one of the themes we'd like to develop is not just how we can be creative in addressing the challenge of unmet need to deliver health services and surgical services to the vast proportion of the world's population that doesn't have access to them, but also what we can learn in doing that about how we can also improve the sustainability of the care that we provide here at home as well. So without further ado, I'd like to introduce our first speaker, who is Dr. Nia Zalamea. She's director of the University of Tennessee Health Science Center Global Surgery Institute and also has a lot of experience with nonprofit outreach to providing surgical services to otherwise underserved populations.
Good afternoon. Thanks so much to all of you for coming after lunch and for having an interest and passion around this topic that's very close to all of us here. It's an honor to be here, and I'll be talking specifically about challenges around providing surgical, obstetric, trauma, and anesthesia care to planet Earth. I have no financial disclosures, but I do think it's helpful to understand where our perspectives are coming from. I was trained as a bread and butter general surgeon for a small community in Virginia and practiced there primarily in the early part of my career. I spent over 20 years doing work with my family in the medical and surgical realm with a nonprofit in the Philippines and continue to do so today. And I'm going to bring us back to 2015. And when we see these numbers and stats, we can become very complacent, both with regards to the relationships that had to be in place in order to gather this data. So one, kudos and I want to pay homage to the efforts and the relationships that were in place to be able to describe this data, but also specifically to understand that these numbers have not gotten better. That back in 2015, of course, if you have not forced yourself to read the Lancet article, I encourage you to do so, but we learned some very painful statistics, realizing that 5 billion people in the world lacked access to safe, affordable, and surgical, obstetric, anesthesia, and trauma care. And in order to meet the need, we needed an additional 143 million procedures performed, and that there were a significant number of people who were experiencing a catastrophic expense, not just, we are very familiar with that here in North America, but all over the world. And that if we look down at the data, specifically with regards to daily adjusted productivity years, looking at finances, education, et cetera, that investment does pay off, not just in saving lives, but promoting overall economic growth for a country. And so we had these incredible plans that were laid out by an incredible group of researchers, visionaries, and people who had deep relationships in the countries we were talking about. And Sustainable Development Goals were released. There were 17 of them. They were released in a very well laid out article in 2015. And when we look at it, did not put this up here intending for you all to read this chart, but to understand that there was a national obstetric and anesthesia care and surgical care plan for every country. And that alongside those specific goals, there were metrics alongside them. And there was accountability of who was going to be deploying these projects per country, and there was a timeline developed. Wonderful. This is exactly what we needed at the time, and I still remember the first day that I read this article. Coming from the nonprofit and community surgery world, I thought, oh my goodness, we now have a description for the problem, and now we have a potential plan to be able to know how to integrate into the solutions. And so specifically, when we look more closely at this plan, the reason why it has the year 2030 at the top was because the anticipated timeline was that it was going to take 15 years in order to achieve some progress in these primary 3 areas, looking at specifically at the top, preparedness. Group number 2 has to do with delivery of care, and number 3 has to do with impact, primarily financial. And that in each of these realms, there was needing to be some very specific achievables that had to be obtained in order to really have an impact on those initial numbers that I discussed at the very beginning. And so when we look specifically at preparedness, this has to do with infrastructure, not just with workforce, but in terms of access for people to be able to actually gain an opportunity to experience the care that we provide. We knew that we needed to, and the goal was to be able to provide at least 80% of the care that was currently at a deficit, that we needed an additional 20, either providers of surgery, anesthesia, obstetric care for every 100,000 people, and I'm not sure how well versed you are in your own statistics back home, but these are some very similar statistics that we use in the public health data in the United States to look at access to care even in rural America. So aside from that infrastructure piece and being able to have people to deliver the care, specifically let's look at not just the quantity, looking at volume, an additional 5,000 procedures being performed for every 100,000 population, but also the quality of that care. And at this time, really asking that 100% of the countries involved actually start tracking their data, not specifically with morbidity, we're going to start with mortality. And so that was the goal of that we would achieve that by 2030. And then specifically looking at impact, I'm not sure what the statistics are here in Canada, but we know in the United States, for example, over 80% of all personal debt is related to healthcare expenditures. It is enough to put people into bankruptcy. It's enough to derail any educational plans for people who are first-generation college attendees. It's enough to derail multiple generations of productivity. And so specifically looking at that, they didn't ask for anything less than 100% protection by 2030. So we had these wonderful goals, these wonderful measurables, and per country had identified people who might be able to actually make it happen. So what happened? Unfortunately, we had several things happen. We had COVID-19, we have the conflict between Ukraine and Russia, and then we, of course, have this overwhelming, looming climate change. That has been present since I remember the first Earth Day I experienced in 4th grade, which is quite a long time ago. So where do we go from here? And what exactly have these three different very specific events in the world, they're just specific events in the world, but there are many more that have derailed our Sustainable Development Goals. Well, we have more data to come in September of this year, a full report on the Sustainable Development Goals, and specifically with regards to access to safe obstetric, surgical, trauma, and obstetric and anesthesia care. That is goal number 3. So specifically looking at that, just with COVID-19, these are all the downstream effects. These are just the most impactful, not just with regards to frontline workers and losing over 115,000 of them to COVID-19, but we all know in our own home practices, we've lost many more even to retirement or early leaving the healthcare field. We've lost progress in terms of tuberculosis and malaria. For the first time since 2005, we've actually had an increase in the mortality from those two communicable diseases. We've had an imbalance in terms of how vaccines are delivered. We've had a major disruption. Over 92% of countries involved have had a major disruption in the basic provision of what they have deemed essential care that is inclusive of surgery, but also includes even communicable diseases. So the disruption has been incredible, and at the end of the day, both access and workforce have suffered as a result of COVID-19 and much more. And so this is a bit of a heavy slide to look at, but on the one hand, back in 2015, we had this incredible lift of data and a trajectory through which we were going to be able to find ourselves a way to kind of lift up the healthcare systems around the world that involved increasing our workforce, increasing access, having a sense of what our mortality was around surgical care, having an increase in volume, and minimizing economic impact on the individuals and families experiencing this care. On the other hand, we have COVID-19. We have not just the war in Ukraine, but also additional other conflicts and climate change. And I wanted to spend a little bit of time on this left side, even though none of us want to spend our time there. But around this, when we specifically look at this report, the preliminary report from the Sustainable Development Goal report that's coming out in September of this year, we know that at minimum, an additional 75 to 95 million people are living in extreme poverty as a result of one of these three events. Just gonna let that settle for a second. Additionally, with regards to supply chain, if any of you are involved in shipping anything on an ocean ship liner or a container, you know that the delays were not just a result of COVID-19, but continue to be delayed to this day on the order of months to years around the world as a result of ongoing conflict and disruption of flow. And that, of course, affects every industry, including healthcare. Additionally, because of that supply chain, and this is a fact I did not realize, that over 200 countries in the world rely on Ukraine or Russia for more than 40% of their wheat supply for the country. So the disruption in food supply, specifically as a result of this one conflict that feels very, very far away, but is also very, very close, is something that is affecting food security in countries. And then the ongoing conflicts, not just in Ukraine, but elsewhere, that additional 2 billion people today are involved in a conflict in their home country. And then, of course, the excess deaths of 15 million people as a result of COVID-19. So I'm not here to be all doom and gloom. I'm going to race through. There are some questions about universal health care coverage. There's actually a new index that looks at universal health care coverage index, not just to look at the availability of access to care, but also the quality of that care. And this group actually has been looking at these indices across the world. And I'm going to flash over to this map here, which at first glance you might think actually may be the same map from that Lancet article back in 2015, but it's not. This actually is very similar because it maps out universal health care coverage indices around the world. And when you put side by side with the coverage of essential obstetric, anesthesia, and trauma care around the world, it's quite similar. The red is bad, blue is good. So I'll let you all just absorb that for a second. And when we look at this, the WHO has actually, a couple of years ago, put out a perspective, a document to say that perhaps we know that the issue is around this non-communicable diseases, that people have underfunded it, even around universal health care, but how are we going to get at it? And their suggestion is that we get at it through primary care, much in the same way that we do in our home countries. And that by going through our primary care lens, we can have a handle on perhaps following access as well as quality of care, and then also perhaps create a little bit more resiliency, because generally speaking, we understand that around the world, all of our healthcare systems are largely unprepared for crises. What about us? This is where I'm going to end here, because I know my colleagues will be talking more about solutions rather than problems. But I think that when we go home after this conference here, one thing that we can think about is how have all of these conflicts, whether it's the Ukraine conflict, whether it's the disruption in surgical education with COVID-19, or it's climate change and supply chain, how has it affected our own programs if we're teachers and learners? And there are actually folks looking at this. There's a JACS article in December of 2020 looking at workforce development and how COVID-19 affected surgical volume and well-being among surgical trainees. It had a negative effect, is my summary. CT surgery trainees, same thing, specifically looking at the volume of CT surgery cases around fellows, and greater than 60, and this is an international survey, both US and international base, over 63 respondents reported that there was an over 50% reduction in their volume, case volume during training. And there's more to come on this. So with that said, I'm going to conclude that we are still back at the same map from 2015. We'll have more data in September of this year. We have an opportunity to focus and refresh our data, not only worldwide, but also here at home. Thank you.